In this video, we will discuss regarding the another viral disease, that is Rinderpest. In the previous video, we completed the FMD, and that is caused by the virus FMD virus of the genus Aphthous virus. That is mainly prevalent in the cloven-footed animals, and that disease is resistant to the horse and donkey. The affected animal shows the formation of vesicles on the mouth and in between the clefts. And in case of affected young cows, there is the microscopical lesions, that is the necrosis and degeneration of myocardial fibers will be there in the heart, and that lesion is called as Tigrad heart appearance. Now let us come to the Rinderpest. This is now we will not encounter in a field condition. This disease is eradicated from India. It is also called as cattle plague. This disease is also an acute. It is also highly contagious viral disease of cattle, which is characterized by high fever with necrotic stomatitis, gastroenteritis, diarrhea, and high mortality, which is caused by the morbillivirus. But in case of FMD, we will not encounter any GIT related problems. But in the Rinderpest, here we can notice the necrotic stomatitis, gastroenteritis, diarrhea with high mortality, and it is caused by morbillivirus. But their FMD is caused by picornavirus group, that is FMD virus. It is caused by morbillivirus. And Rinderpest has not been reported since June 1995 in Indian subcontinent. Susceptibility to this disease mainly the cattle and buffalo, but also reported in sheep, goat, and pig. Mortality is 100% in exotic breeds and 50% of mortality in indigenous breeds. It is transmitted by it is having the incubation period of 2 to 3 days in experimental inoculation, and in contact infection the incubation period ranges between 6 to 9 days. The virus excreted in the body secretions, the ingestion of the contaminated feed and water, or inhalation or by mechanical transmission is also there. Now let us come to the pathogenesis. The virus is inhaled in the infected droplets. Then it penetrates through the epithelium of upper respiratory tract, and it multiplies in the tonsils and regional lymph nodes. From here it enters the blood. Inside the blood it enters the mononuclear cells, which disseminate to other lymphoid organs, lungs, and epithelial cells of mucous membranes. And this virus has high degree affinity for the lymphoid tissue and mucous membrane of alimentary tract. But in case of FMD, the virus has high affinity towards the epithelial cells. That point we have to keep in our mind, and this will differentiate between the pathogenesis of FMD virus and the Rinderpest, that is morbillivirus. And there is a pronounced destruction of lymphocytes in the tissues, and it is responsible for marked leukopenia. There is focal necrotic stomatitis. Enteritis are the direct result of virus infection and replication in the epithelial cells of the alimentary tract. There is a severely affected animal shows the death. It is because of the severe dehydration, but in less acute cases, death may be from the activated latent parasitic or bacterial infection. These infections aggravate because the animal is immunosuppressed as a result of destruction of lymphoid organs by the virus. This virus has high affinity towards the lymphoid organs. These organs are necessary to provide immunity to the body. If these organs are destructed by the virus, and such animals undergo immune suppression or immunocompromised animals, leading to the secondary infections like latent parasitic infections or bacterial infections, and those are the secondary causes which may be responsible to the death of the animal. Now let us come to the clinical signs. The affected animal shows high fever and restlessness, dryness of the muscle, and constipation. The other signs include photophobia and excessive thirst, starry coat, retained rumination, retarded rumination and anorexia. Excessive salivation is also noticed. Rashes may develop in those parts of the body where the hair is fine in nature, and the mucous membrane of lips, gums, and tongue revealed with small vesicles resembling the bran-like deposits. And the major clinical signs is shooting diarrhea with fetid odor. Shooting diarrhea is nothing but the diarrhea excreted from the will fall off to the ground some distance from the animal, and which is also in a more liquid form. And there is dehydration and a marked leukopenia with a drop in lymphocyte count. Grossly, the virus produces lesions in oral mucosa. Abomasum reveals necrotic foci and hemorrhagic streak more seen in the pyloric region of the stomach. And the folds of abomasum are thick and edematous. If the disease progresses, abomasal mucosa shows irregular ulcers of different size. And the virus has got affinity for lymph body tissue, and in the intestine the pair patches are swollen and ulcerated. Duodenum and ileum revealed streaks of hemorrhages and erosions, and in the large intestine, at the region of ileocecal valve, may be markedly swollen. And the pathognomic lesion in the Rinderpest is these the linear hemorrhages on the fold of mucosa of the rectum. Please keep in mind, this is the mucosa of rectum, that means in large intestine. There is clearly noticed linear hemorrhages on the fold of the mucosa of the rectum, which appear like the zebra marking, and which is the pathognomic in Rinderpest. The same in case of FMD, there is clinically important lesions that we can encounter is called as Tigrad heart appearance, and that is nothing but the necrosis and degeneration of the myocardial fibers in the affected young calves. The lesions are more severe in large intestine with ulceration and diphtheric patches, and the liver show chronic passive congestion resulting from the cardiac and pulmonary complications, and petechial hemorrhages and erosion in the larynx. There is also a tracheal hemorrhages, alveolar and intestinal emphysema, subepithelial and subendocardial hemorrhages. Petechial hemorrhages and erosion may be seen in the bladder and vagina. Purulent conjunctivitis and ulceration of the cornea may be noticed in sheep and goat. Mouth lesions are usually not seen. Microscopically, the epithelial surface reveals the ulcers, hemorrhages, edema, necrosis, and leukocytic infiltration along with the multinucleated cells. And eosinophilic cytoplasmic inclusion bodies form in the mucosal epithelial cells and the giant cells. Intranuclear inclusion bodies are rare, but eosinophilic cytoplasmic inclusion bodies are formed in the mucosal epithelial cells and the giant cells. To diagnose this Rinderpest, it can be diagnosed by using symptoms and clinical lesions, and complement fixation test, agar-gel precipitation test, virus isolation, and a diagnosis on the tissue cultures by using specific complementary DNA probes. And isolation of the Rinderpest and PPR virus can be differentiated presently. Polymerase chain reactions are also help in the isolation of the virus. By using these techniques, we can diagnose the Rinderpest. But at present, this disease is not any prevalent in a field condition. This is eradicated from the Indian subcontinent. And the point from the examination point we should have remember is the zebra marking. That is nothing but the linear hemorrhages on the fold of mucosa of rectum. And the clinically, the affected animal shows the shooting diarrhea. This is an important clinical signs. And the affected animal will undergo a severe immune compromisation, and that will lead to the secondary bacterial infection or any latent parasitic infection. That is the maybe the cause of death of the animal. And this is transmitted by the ingestion of contaminated feed and water or the virus in the droplets. And susceptibility mainly to the cattle and buffaloes may also reported in a sheep, goat, and pig. The virus is which caused the Rinderpest is morbillivirus, and it is an acute, highly contagious viral disease of cattle, which is characterized by the high fever and the lesions of GI tract. Those include necrotic stomatitis, gastroenteritis, diarrhea, that is nothing but the shooting diarrhea, with high mortality in exotic breeds that is caused by Marbili virus. This is about the Rinderpest. It is also called as cattle plague. In next video, we will discuss the another disease, that is malignant catarrhal fever. Thank you.